Okay, so we're going to unlock some secrets today.
Oh, wow. Secrets.
The secrets of clinical psychology assessment.
Okay.
We're talking about all the tools and techniques that help psychologists, really understand what makes people tick.
Yeah.
A
Yeah.
bit like detective work.
It is. Yeah.
You're piecing together all these clues to paint a full picture of somebody.
Right.
Their strengths, their weaknesses,
Yeah.
what challenges they're facing.
Exactly. It's about going beyond just slapping a diagnosis on someone.
Right.
Think of it as like a journey of understanding.
Okay.
We're using tests, we're doing interviews, we're even looking at their past to try and build a really complete picture.
Yeah.
And it's not just a one-time snapshot. It's an
Yeah.
evolving understanding,
That's fascinating.
Yeah.
I've always wondered how assessment has evolved over time.
Yeah.
It just seems like a field that would be constantly changing.
You're right. You're right. Actually, interest in assessment, it kind of dipped in the 60s and 70s, but then it bounced back in the 80s as clinical psychology became more and more specialized.
Okay.
So, for example, if you wanted to be a forensic psychologist, someone who evaluates, things like competency to stand trial,
Right.
you had to know a lot about assessment.
So let's talk about the tools.
Okay.
What kind of tests are psychologists using out there?
Oh, there are so many tests, but they
Yeah.
typically fall into a few main categories, right?
Okay.
We've got intelligence tests,
Mhm.
things like the WISC Vive. We
Wow.
have personality tests, like the famous MMPI, or
Right.
even the Rorschach,
Yeah.
although that one's used less these days.
Interesting.
And then you have attitude scales, like the Likert scale,
Okay.
that you might see in a survey.
Wow, that's a lot. So how do psychologists know which test to use?
It all depends.
Yeah.
It depends on the individual and the specific reason why they're being referred for
Okay.
assessment. So, a child struggling in school would get different tests than someone being evaluated for a mental illness.
Right.
And it's really important to remember that, testing is just one piece of the puzzle.
Right.
Assessment is much broader.
Okay.
It takes into account data from many sources
Yeah.
to build a comprehensive understanding.
So we got some really interesting stuff on a tool called the FAMHA scale.
Okay.
And it seemed like it was designed specifically for people who are dealing with both mental health and addiction challenges.
The FAMHA scale, which stands for Functional Assessment of Mental Health and Addiction,
Okay.
is really unique because it goes beyond just diagnosing someone.
Right.
It helps us understand how these challenges actually impact their daily life, how well they're functioning at work, in relationships, even just in everyday activities.
So it's about understanding the person as a whole and not just labeling them.
Right, exactly.
We saw that they mentioned 3 different client profiles
Yes.
that the FAMHA addresses.
Mm-hmm.
Can you break those down for us a little bit?
Absolutely. It recognizes that not everyone with addiction and mental health issues is the same.
Right.
So we have these profiles,
Mhm.
MISU, which stands for mentally ill substance users.
Okay.
Then we have SUMI, which is substance using mentally ill.
Okay.
And then we have MCSU, medically compromised substance using.
Okay.
And these allow clinicians to really tailor the treatment to each specific profile for better outcomes.
That makes sense. You wouldn't treat someone who primarily struggles with addiction the same way as someone whose main issue is a mental health condition.
Exactly.
There's a personalized medicine for mental health.
You could think of it that way.
And what's really valuable
Yeah.
is that a FAMHA isn't just used for, diagnosis and treatment planning.
No,
It also measures outcomes.
it does.
So you can actually see how the treatment is working.
Yes, and if we need to adjust our approach.
That's amazing.
And it's designed to be really practical.
Okay.
In those real-world clinical settings.
So it gives you a complete picture of where someone is,
Yes.
how they're progressing,
Mm-hmm.
all while taking into account their unique situation.
Exactly. It assesses 6 key dimensions. Things like their emotional well-being, how well they function socially,
Right.
their living situation,
Wow.
even their risk of, harming themselves or others.
Right.
So it gives a really holistic view of the person.
Okay, so the FAMHA is a fascinating example of a specialized assessment tool.
Right.
But where does the assessment journey usually begin, regardless of what tools are used?
It always starts with a question,
Okay.
a referral question.
Okay.
So someone, whether it's a worried parent or a teacher, a judge, or even another doctor, asks a question about a patient.
Right.
And they might be looking for answers
Yeah.
or just a better understanding of what's going on.
I imagine those questions can vary a lot.
Oh, absolutely.
It could be anything from, like, why is my child having trouble focusing in school, to, is this person even capable of standing trial?
You got it.
Wow.
And the clinician's job is to really figure out the heart of the question,
Right.
even if it needs to be rephrased a bit.
So you're like a detective
Kind of.
trying to solve a case.
Yeah,
You've got to sift through all the initial information to find the real mystery.
exactly.
And sometimes I imagine you might even have to push back on a referral question.
We do
For
sometimes.
best look reason.
Right, right. Sometimes the requested information may not truly be in the best interests of that individual.
Right.
For example, let's say a parent wants their perfectly healthy child to get an IQ test just so they can brag to their friends.
Oh, wow.
A clinician might refuse
Yeah.
because, focusing on a number could actually be harmful
Right.
to the child's self-esteem.
That makes sense.
Yeah.
You wouldn't want to use these powerful tools in a way that could potentially hurt someone.
Exactly.
So once the referral question is clear and
Yeah.
ethically sound,
Right.
how does assessment actually guide the therapy process?
And it really informs every step of the way. It helps us figure out if therapy is even necessary, what the best setting would be,
Okay.
what specific areas to focus on during treatment,
Right.
and how to measure whether it's even working.
So it's not just a starting point.
No.
It's woven through the whole therapy journey.
Precisely. It's a constant source of information that's
Wow.
guiding our decisions.
So assessment isn't just a starting point.
Yeah.
It's woven through the entire therapy journey.
Right.
We've talked about the FAMHA scale
Yes.
and how that works, but I'm curious to know more about all the different kinds of tests
Okay.
that psychologists use. You
Yeah.
mentioned intelligence tests
Yeah.
and personality tests.
Yeah.
What else is out there?
Oh, there's a whole range of instruments.
Okay.
From self-report inventors, where people, answer questions about themselves,
Okay.
to performance-based measures where they actually do something.
Yeah.
They arrange blocks or interpret an image. And those actions reveal a lot about how they think and process information.
So like those wooden puzzles
Yeah.
where you have to fit the different shapes into the right slots.
Exactly.
That's considered a performance-based measure.
It is. And it's not about getting a right or wrong answer. It's
Okay.
about observing how someone approaches the task.
I see.
It gives us insights into their, problem-solving skills,
Right.
their ability to think spatially.
That makes sense.
Yeah.
So you're not just relying on what they tell you. You're actually
Yeah.
watching them in action.
Right. And speaking of action,
Yeah.
have you ever heard of the Rorschach test?
Oh, yes. The Inkblot test.
Yes.
It's featured in so many movies and TV shows.
I know.
But honestly, I don't really understand how it works.
Well, it's a fascinating test
Right.
that uses ink blots to assess personality and emotional functioning.
Mm-hmm.
And there's no right or wrong answer.
Right.
It's all about how the individual interprets those ambiguous shapes.
It sounds a bit like reading tea leaves for the psyche.
Uh-huh. In a way.
Okay.
But there's actually a lot of science behind it.
Oh, really?
Yeah. Clinicians use established scoring systems
Okay.
to interpret those responses and draw conclusions about the individual's underlying thought processes and emotional states.
So what are these scoring systems looking for?
They're looking for patterns
Okay.
in how people perceive those ink blots.
Mm-hmm.
Do they focus on details or the whole image?
Okay.
Do they see movement or color?
Ah.
Do their responses align with what others typically see?
Mm-hmm.
Or are they unique?
Interesting.
It's those subtle clues
Yeah.
that can reveal a lot about someone's inner world.
Okay, so it's not just about what they see.
Right.
It's how they see it.
Exactly.
Their unique interpretation tells a story.
Exactly.
Mm.
And that's what makes clinical assessment such a unique blend of science and art.
Right.
They have to be analytical and objective,
Mm-hmm.
but also open to subjective interpretations and those nuances of human experience.
You mentioned earlier that assessment helps determine if someone even needs therapy.
Yeah.
Okay.
Yeah.
So in our fast-paced world where, stress is like a constant,
Right.
how do you differentiate between everyday stress
Yeah.
and the kind of stress that requires professional intervention?
That's a crucial distinction.
Yeah.
We all experience those ups and downs in life, but when those challenges significantly impair our ability to function
Right.
or cause prolonged suffering,
Okay.
that's when therapy might be necessary.
So it's not just about feeling sad or anxious.
No.
It's about how those feelings are impacting your work,
Yeah.
your relationships,
Yeah.
your overall quality of life.
Right. It's when those feelings become overwhelming
Mhm.
and they start to take over.
Wow.
It's like the difference between having a cold and having pneumonia.
Okay.
Both involve respiratory symptoms,
Right.
but one is a minor inconvenience, while the other can be life-threatening.
Okay. That's a really helpful analogy.
Yeah.
So if someone is feeling overwhelmed
Mhm.
and their day-to-day life is being affected,
Yeah.
that's a sign they might benefit from therapy.
Exactly. And that's where assessment comes in.
Okay.
It helps us understand the severity and the nature of the problem. Is it situational,
Okay.
or is it something deeper?
Right.
Is it likely to, improve on its own, or does it require professional support?
I can see how that would be valuable information for both the individual
Yeah.
and the therapist.
Absolutely. It also helps us determine the best course of action.
Okay.
Is therapy even the right approach?
Mm-hmm.
If so, what type of therapy might be most effective?
Right.
And, how long might that treatment process take?
It's about creating a roadmap
Mm-hmm.
for the therapeutic journey.
Precisely. An assessment is like the compass that's guiding our way.
Speaking of the therapeutic journey,
Yes.
you also mentioned that assessment helps decide on the best setting for therapy.
Right.
Can you explain the difference between inpatient and outpatient therapy?
Of course. So inpatient therapy typically involves, residing at a treatment facility.
Okay.
It's usually recommended for more like acute cases, such as those involving, severe mental illness,
Right.
suicidal ideation,
Yeah.
or substance abuse.
Okay.
And it provides a really structured and safe environment
Mm-hmm.
where individuals can receive intensive care and, 24/7 monitoring.
So it's about providing a higher level of support
Yes.
and supervision for people who might be at risk to themselves or others.
Yes. It's like the difference between staying in a hospital
Okay.
versus going to a doctor's appointment.
Right.
Both provide medical care, but a hospital offers more comprehensive and immediate support.
That makes sense.
Yeah.
So when would outpatient therapy be a better option?
Outpatient therapy is more suitable for individuals who are, generally stable and able to manage their daily lives independently.
Okay.
So they're living at home and they attend therapy sessions, at a clinic or private practice.
So it allows for more flexibility
Yes.
and independence
Right.
while still providing the support of a therapist.
Exactly. And it allows for like more gradual integration of those therapeutic insights into their everyday lives.
Yeah.
They can practice those new skills and coping mechanisms, in the real world.
It sounds like both inpatient and outpatient therapy
Yeah,
have their place,
they do.
depending on the individual's needs and circumstances.
Absolutely. And assessment helps us determine, which setting is most appropriate.
Right.
It's about finding that right level of support
Yeah.
to maximize their chances of recovery and well-being.
You also mentioned that assessment helps estimate how long someone might need therapy.
Yeah.
How do you even begin to predict that?
It's not an exact science,
Right.
but we consider several factors,
Okay.
including the severity and the duration of the problem, the individual's motivation,
Okay.
their support system, and even the type of therapy that's being used.
So like a mild and temporary issue might require a shorter course of therapy
Right.
than a more severe and chronic one.
Precisely. And some individuals might benefit from like a brief solution-focused approach, while others might need longer-term therapy to address, deeper-seated issues.
It's like tailoring the length of the journey to the destination and the
Yes.
terrain.
Exactly. We want to make sure that the individual has enough time
Right.
and support to reach their goals, but we also don't want to keep them in therapy longer than necessary.
Right. It sounds like assessment plays a really vital role
It does.
in ensuring that therapy is efficient and
Mhm.
effective.
Yes. And it also helps us identify any potential obstacles to progress.
Okay.
For example, if someone is, resistant to change
Yeah.
or has difficulty connecting with their therapist,
Right.
assessment can help us address those challenges directly.
So it's not just about measuring outcomes. It's about understanding the process of therapy itself
Right.
and making adjustments as needed.
It's about being responsive to that individual's needs
Right.
and adapting our approach accordingly.
It sounds like assessment is like a really dynamic tool
It is.
that helps therapists adjust the course based on what they're learning
Right.
as they go.
That's right. It's about constantly evaluating, is this treatment working,
Right.
and making those changes as needed.
It's not just setting a plan in motion
Right.
and forgetting about it.
No, not at all.
You're always monitoring progress,
Yes.
looking for ways to improve the process.
Exactly.
So it's a really collaborative process
It is.
between the therapist and the individual
Yes.
working together to achieve, the best outcome.
Exactly. It's a partnership.
Yeah.
Built on trust,
Right.
open communication, and a shared understanding of the goals.
This has been incredibly insightful.
Oh, God.
It's amazing how much goes on behind the scenes. In therapy,
Right.
most people probably think of therapy as simply, talking to a therapist on a couch.
Right.
But it's clear that there's a whole science to it.
Absolutely. Assessment is like the foundation
Yeah.
that supports that whole therapeutic process. It helps us make informed decisions
Right.
at every step of the way.
It's like building a house.
Yes.
You wouldn't want to start construction without first making sure, the ground is stable.
Exactly.
The foundation is strong.
Yes. A shaky foundation can lead to all sorts of problems down the line.
Exactly.
We want to make sure we're building something solid, something sustainable,
Right.
something that will stand the test of time.
So assessment helps ensure that the therapy is built on that solid foundation.
Yes.
And that the individual has the best chance of success.
Precisely. It's about setting them up for a positive and transformative experience.
We've talked about how assessment guides treatment planning, helps determine the right setting, the duration of therapy.
Right.
But can you give us some specific examples of how assessment data is used in practice?
Okay.
Let's say someone is struggling with anxiety.
Okay.
How would assessment inform their treatment?
So if someone comes in and says, I'm struggling with anxiety, we wouldn't just assume they need a specific type of therapy.
Right.
We'd use assessments to really understand what's driving their anxiety, work stress, social situations, something else.
Okay.
And this helps us target the root of the problem.
I see.
We might use something like a self-report inventory, to see how their anxiety levels compare to the general population, or a behavioral observation to see how they respond in anxiety-provoking situations.
So it's about gathering data from different angles to get a more complete picture.
Exactly. And based on that data, we might recommend, cognitive behavioral therapy to help them challenge negative thought patterns, or mindfulness-based therapy to help them manage their, physical and emotional responses to stress.
And would you use assessment data?
We would.
To track their progress over time?
Absolutely. We might have them complete regular self-assessments to see if their anxiety levels are decreasing, or use behavioral measures to track how they're managing their symptoms in real-life situations.
So it's not just about choosing the therapy.
No.
It's about making sure it's the right fit and that it's actually making a difference.
Exactly. And that's where assessment is so valuable.
Yeah.
It provides that feedback loop, allowing us to continuously monitor and improve that therapeutic process.
It sounds like assessment is an incredibly powerful tool.
It is.
In the hands of a skilled clinician.
Yeah.
But are there any, potential downsides or risks that we should be aware of?
It's important to acknowledge that assessment, like any tool, has its limitations.
Right.
It's crucial that we use it responsibly and ethically, recognizing that it's not a crystal ball.
Right.
It can't predict the future with absolute certainty.
Okay.
One potential risk is, misinterpreting the data or overemphasizing the results.
Okay.
We need to remember that assessment is just one piece of the puzzle.
Right.
And it should always be considered in the context of, the individual's unique circumstances and experiences.
So it's not about blindly following the numbers.
Right.
But using them thoughtfully.
Yes.
To inform clinical judgment.
Exactly. And it's also important to be mindful of potential biases.
Okay.
For example, a test that was developed, for one population group might not be appropriate or accurate for another.
That makes sense.
Yeah.
We need to make sure that the tools we're using are culturally sensitive and relevant to the individual.
Right.
So as we wrap up this deep dive,
what's one final thought you'd like to leave our listeners with?
I'd encourage everyone to really appreciate the power of assessment, both for themselves and for those around them.
Okay.
It can be an incredibly valuable tool for understanding our strengths, our challenges, and how we can grow and thrive.
It's not about labeling or judging. It's about gaining insights that can lead to, greater self-awareness and positive change.
Exactly.
I feel like we've only scratched the surface of this fascinating topic.
Yeah.
And I'm definitely inspired to keep learning more.
Oh, me too. There's always more to discover.
Right.
This field is constantly evolving.
Yeah.
New research and developments are emerging all the time.
It's exciting.
It is.
So keep exploring.
Yes.
Keep asking questions. And never stop seeking a deeper understanding of yourself.
Right.
And the amazing complexity of the human mind.
Couldn't have said it better myself. Thank you for taking us on this incredible journey
Oh, you're welcome.
through the world of clinical psychology assessment.
My pleasure.
We hope you've enjoyed this deep dive.
Until next time. Keep diving deep.